Obesity has become a huge problem for our nation, but also it is even worse in minorities and low-income populations. In the South, where we have more minorities that live in the South, this problem is even worse. Like for example, Alabama is one of the fattest, if not the fattest states in the Southeast. And if we didn't do anything about it, probably 60% of our populations will be overweight or obese. The problem of obesity is very complex. One thing you can see is that the environment we live in, the choices we make, the access to nutritious food, access to environment that can allow for physical activity, and then poverty, employment, education, and all these factors have been affecting the low-income minorities, especially those that live in the Southeast. But if you can think about where fast food places open, not in affluent, upper class, majority white towns or areas. If you want to look at fast food places, you'll find them more into the low-income communities. So the access to healthy food is just limited. The opposite too, there is access to unhealthy food. We found also that these social determinants of health can affect also our biology, not just behavior. For example, we just received a grant from NIH, a regional grant for addressing obesity and how it intersects with social determinants of health. This is a $13 million grant that will be conducted in Alabama, Louisiana, and Mississippi. And we're looking how these factors affect even our biology. Like, for example, if you have a child, and since that child is born, all what you're feeding them is carbohydrates, is it sugar or carbs? We found that this can impact the biology of this child, and they can develop type 2 diabetes, which is adult diabetes at earlier age, because they've been feeding the carb all the time. And we're looking at some of the biomarkers that unhealthy food, even during pregnancy for the mother and the child, that can be after they're born, increase the risk for the mother and the child to become overweight and obese as they grow up. If there is a child that lives in an area that is unsafe to go out and play and doesn't exercise, or go to a school that doesn't have the resources for activities and physical activities, or they provide them with unhealthy food, lunches, how that child is going to grow up with a healthy behavior, going out and exercise and have a healthy habits. So those social determinants of health can impact the biology and the behavior of a person over life. And so we really need to think more seriously. It's not just blaming the individual, say, you don't eat healthy, you don't exercise, you know about eating low fat or low calorie, and you have to adopt a healthy lifestyle. There are a lot of factors that we can think about now, that we know about now, that impact obesity, that if we think about how the social factors and where we live and where we work and where we play, like people say, it is not your DNA code, it's your zip code. You learn your behavior as you grow up. So if you grow in a community, it's a low-income community that doesn't have sidewalks that you can walk, doesn't have safe places, no lights, there is crime in the streets, or it's not, doesn't have parks, and that child is sitting in there, can't go out and play, or that child is in a school that doesn't have programs for physical activity. it for sure, when this child grow up, is not going to adopt the behavior of active lifestyle. So that's also a problem. We tend in the medical community to focus a lot about our DNAs and our genetics to decide about the risk of diseases. But if we look also at a condition as obesity, we always say that it is not just your DNA, it's not just an inherited thing. It's not like because your parents are obese, you are obese too. It is not your DNA code, but it's the zip code where you live. If you think about why children that they live, or older adult, that they live in low-income communities have higher rate of obesity, higher rate of chronic diseases, and lower and higher mortality rates from these diseases compared to adults and children that they live on upscale communities. So low-income communities have less access to healthy food, what we call the food deserts, less access to parks, high access to fast food places, low access to safe and places for walking or exercising or running, no big grocery stores. You're not going to find a large chain of grocery store that would open a store in a low-income community. They all open in, in other communities that they have more buying power. So this community would be left out without access to the main principles, the main factors that can really get you to make good choices. So it's not just to blame the person for good choices, how we can have that good environment for people to be able, after you do the education, the awareness, okay, then where I'm going to go and exercise, where I'm going to get my healthy food. So it's really a more complex societal issue than just a disease. So now we look at a more holistic approach for addressing health disparities. We have been working in a lot of programs to address health disparities, and through established community coalitions to listen exactly from the community, how can we solve this problem, instead of we say, we physicians are going to come and do this and this and that. And they were clear. They said, if we don't have good economic development and good environment, doesn't matter how many prescriptions you gave us, we're going to get healthy. So I think the medical communities now need to think about partnerships. They need to partner with other agencies, private and government and medical entities. We need to have some more of a partnerships with other entities to address this. It's not going to be only the physician in his or her office that can impact the lifestyle of that person once that patient leaves that clinic. They're going to go out back to a community that doesn't have the resources to do what the doctors is recommending. So we need to start to have some kind of partnerships with community organizations, programs like, for example, the Y, recreation centers, policy makers and officials, and work together to improve the environment, improve the education system, improve the transportation system. And I know that this is sound difficult, but I think if we stay doing what we're doing, as you can see, the gap is widening. We're getting more obese, we're getting more sicker, and this impacts not only the health of the individuals, it impacts all our environment and our society. You'll have people that they're not productive in their work, sicker work site, increased medical cost. So we really need to try to find more innovative way to work together to address obesity. And that's actually one of the focus of the grant that we received, how we develop partnerships so the scientists can disseminate their information to policymakers so we can make some decisions about that. What I would like to tell a physician around the country when they see an obese, low-income individual or a high risk, just think a little bit about where they're coming from. We're looking into the life course of the individual from birth to elderly, to see how the critical points in our life course can be impacted by the environment and trigger the change in our biology. You can call it epigenetics, or you can call it, like developing some risk factors to increase your risk. So this grant, trying to look at the intersection of the basic science, the behavioral science, and the social science. So this is, again, another comprehensive approach. It's not just behavior change or a community improvement. It's more of how do you intersect the discovery with translational research to disseminate this to the community. We funded projects in collaborations with University of Alabama at Birmingham and Jackson State University and University Medical Center, Mississippi, to look at pregnant women, African American versus white, in the Black Belt and in Delta, Mississippi, and see how their lifestyle and access to healthy food can impact their weight and the weight of their born child, and how these social determinants can really impact their biology in the future of that child for increasing risk for obesity. We're looking at also youth in New Orleans. We're doing a study looking at youth adult and following this group of young children to see any biomarkers that can be changed because of access to unhealthy food. But in the same time, we're establishing a lot of partnerships with community organizations, with health department, with faith-based organizations, so we can listen to the community and see how, what else we can do, what are the barriers, what are the factors that can impact their health and how we can improve that, and how they can help us to disseminate the information to their constituents and also to policymakers. One thing that we're trying to look at, one thing that we know that increased risk of diabetes, for example, is the metabolic syndrome. So how this metabolic syndrome starts early. It could be because of the unhealthy nutrition and food intake as, over the course of life of the disease. We know that there are critical periods, and that's why we said we're looking at the life course. There is critical periods when, that's why prenatal nutrition is very important when the infant is getting and getting the nutrition during pregnancy. So we know that this is a critical period because this is a critical period of development. We know also when adult, the youth and puberty, that's another critical period in development. So you could be influencing that development by external factors, not only internal genetics. Like it can be food, it can be environment pollutions, it can be a lot of other influence. We know also that there is another critical period for women, like pregnancy. We know, like on adult life, we know for women, menopause. We know for the elderly. So there are some, and those are the things that we're trying to look over the life course and fund studies to promising scientists to try to help us and see how the exposure of the social determinants of health and that person lifestyle in that critical period can increase the risk of becoming obese or developing diabetes. And the reason also that we're very interested in obesity, that now we found that obesity really is a risk for cardiovascular disease, for diabetes, for cancer, and for disability, being overweight, arthritis. For every condition, there is genetic disposition. For cancer, there is. For cardiovascular disease, for diabetes, for obesity. But it's not the whole story. It could be like only probably 20-25% of the cause of the increase of the risk. But in most conditions, 70-80% of the cause of that disease is not related to genetics. It can be related to behavior, like for example, cancer screening, or diet, or physical activity, or what we call the environment and pollution. So there are a lot of other factors. So we still need to look at those genetics and look at this group of populations that they have genetic disposition for these diseases and obesity. But we should not ignore that 80% of the conditions are caused by other factors that we can control. Genetics is load the guns, but environment really pull the trigger, because if we can see the increase of the rate of obesity or heart disease or diabetes over time, we've had these genetics all our life. So why now the increase? If you look at our environment, even look at the eating habits and the commercials for getting people to be wanting to eat more of the unhealthy food. Look at the diameter of our dinner plate. One time I heard a speaker that said, go and look at the cupboard of your grandmother, China, and look at your plate. You will find that in the old days, it was a much smaller plate. Now you go and buy plates and you can see the oversize of the plate, and you have to fill all this. So we also pushed it, and we can't blame it all in genetics. We as a society pushed it to have more options, and I hope that we now try to increase the options for healthy food and healthy behavior and physical activity. If you go out to the community, people really want to lose weight. I do a lot of programs at lower income communities, and they're really eager to get healthy and lose their weight. But now it is time for us to help them with the environment and the resources to be able to achieve their goals, and look at more creative programs to how to do that. We talk a lot about obesity. We talk a lot about healthy choices. But if you live in an environment that I don't even have a car, or gas is very expensive, and I have to cross my town to go to another community to find a store to buy, but next door to me I have this small store that has some canned food and maybe 100 kinds of alcoholic beverages, but few cans of food. What I'm gonna do? And that's actually what we found, for example, in the lower Ninth Ward in New Orleans, when we did some environmental scanning to see what are the availability of healthy choices, and that's all what they have out there. I think for minority and obesity, it's very important to engage not only the individuals, but we need to understand their social network and their support, and work through these social networks. For example, churches are very important. The schools in the community and the parents, they really need the support because they have a lot of barriers with their lifestyle. They're single mothers, they work, maybe they work more than one jobs. So we need to understand their social networks and the barriers that they face every day, and try to work with these social networks to give them the support to make the right choices. And that's very important, in addition to have access for sure to health care. But what is more important, work with their own environment and their own social network to help them make the right choices. I think that the media is doing better, but it can be improved. We're still, the media demonstrate the healthy person more towards the majority populations. The healthy person is always the young, the thin, the beautiful, and from the majority background more. We need to do more giving role models that they're actually also in our minority populations, and focus more on the children and the youth, because those are the future that they can influence their community. We're working with a program called E-Teen. You're trying to work with high school children so they develop their own messages. So engage the teens and from the minority populations and the children, because I think we still, with our news media, focus more on the traditional mainstream population.